This video is intended to help you understand what to expect when you or your loved one comes to the chemotherapy treatment unit for cancer treatment. It's also intended to clarify terms that you will hear. We'll start by explaining some terms, and then we'll walk you through a typical visit. The chemotherapy treatment unit is also called CTU. The CTU is an outpatient clinic where all of the healthcare team members have specialized training in the care of cancer patients requiring chemotherapy. Chemotherapy, sometimes called chemo, is the use of medications that kill cancer cells by stopping them from growing, multiplying, or spreading to other parts of the body. The medication circulates through the entire body to reach cancer cells that may have spread from their original location. For this reason, chemo is sometimes called systemic treatment. Chemo drugs may be used alone or in combination with other drugs. The combination of drugs that you receive is called your chemotherapy protocol or regimen. You'll receive information about your chemotherapy in the cancer clinic before you start your treatment. In the chemotherapy treatment unit, your nurse will reinforce the information that you need to know when you're receiving treatment. The average course of chemotherapy treatment is 6 months. The frequency of visits varies, usually ranging from 1 per week to 1 per month. The length of each visit can range from half an hour to 7 hours, depending on your chemo regimen. This video will describe, step by step, what to expect when you visit the chemotherapy treatment unit for your treatment. You are going to be treated in CTU as an outpatient, which means you will not stay overnight in the hospital during treatment. Instead, you'll come to the chemotherapy treatment unit and go home after treatment. At the general campus, the CTU is located on the second floor of the cancer center. The closest parking lot is the main entrance of the cancer center at the back of the general campus. At the Irving Greenberg Family Cancer Center, the CTU is located on the 4th floor. The parking lot is at the front of the building. Some of our patients may receive treatment in another area of the hospital or at one of the cancer program's 4 satellite chemo treatment units, which are located in Hawkesbury, Winchester, Renfrew, and Pembroke. However, this may depend on your type of cancer or the type of chemotherapy that you're receiving. Both CTUs are bright and open areas, designed to make you feel comfortable and safe. To prepare for your chemotherapy appointment, you're going to be asked to do the following. Complete any testing or blood work that was ordered to be done before chemotherapy in the time frame specified. Blood work is usually done 1 to 2 days before chemo. Make arrangements to have someone pick you up after treatment. On the day of your chemo treatment, eat a normal meal at home. Take all of your usual medications, unless your physician has told you otherwise, and write a list of your questions to bring along with you. In keeping with the Ottawa Hospital's scent-free policy, we also ask you to avoid using perfumes, colognes, or other scented products on the day of your visit. We encourage you to bring a family member with you to your appointments, but please note, you may be limited to 1 visitor per visit in the CTU for safety purposes. When you arrive at the chemotherapy treatment unit, the first thing you're going to do is check in at the reception desk. You're going to be asked to show your health card and your green hospital card at each visit. The receptionist verifies that all information, testing, and orders are completed. You'll be given a patient identification bracelet and asked to complete your symptom assessment at the computer kiosk in the waiting room. If you prefer, you can complete your symptom assessment online from home. After you complete your symptom assessment, we ask you to take a seat in the waiting room until we're ready to call you in for treatment. Please note that we strive to bring patients into the unit on time, but it is truly not always possible. Unexpected delays do happen. We appreciate your patience in these situations. If we're not bringing you in on time, it's because other patients have had unexpected needs and additional care requirements. Be assured that we'll provide the same level of care for you if you ever need it. Safety is our first priority in these cases. When the team is ready for you, the receptionist or nurse will call your name aloud and direct you to a treatment area, for example, Pod 1 or Stretcher Bay. You may be assigned to a different area at each visit. When you arrive in the treatment area, a nurse will greet you. Your nurse will measure your height and weight at the first visit, and possibly at later visits if needed. This information is then used to ensure that you receive the correct dose of chemo. Your nurse will ask you to state your name, address, date of birth, and allergy status at each visit before giving you any medication. This is a safety measure to ensure that you are properly identified and that you receive the correct medications. This may be done a number of times during your visit. Your nurse will go over the results of your symptom assessment to review how you were feeling that day and how they can help you manage your symptoms. Your nurse will also review your blood and test results to ensure that it's safe for you to receive treatment. Your nurse will also review your chemo orders with you, discuss side effects that may occur, and answer your questions. When your nurse has verified that it's safe to proceed with your chemo treatment, he or she will bring your chemo orders to the pharmacy in the CTU. The pharmacist will review your chemo orders and provide any medications you need to receive before the chemotherapy is started, such as medication to prevent nausea. Then the pharmacy will prepare your chemo. On average, this takes about 30 minutes, but it may be a little bit longer. This is because most chemo drugs can't be prepared in advance. While you're waiting for the pharmacy team to prepare your chemo, your nurse will check your temperature, blood pressure, and pulse, give you any pre-medications required, and if needed, start an IV. If your medical oncologist has prescribed a PICC or a port for you, the chemo will be given through that device rather than an IV. PICCs or ports are devices that are inserted into large central veins for long-term use for chemo infusions. The pharmacy alerts the nursing team when the chemotherapy drugs are ready using an electronic notification system. The nurse goes to the pharmacy to pick up your medications. Before giving your chemotherapy, the nurse will make sure that all medications provided by the pharmacy are exactly what was ordered. Your nurse will check the information on the medication orders to make sure that it matches the information on your identification bracelet. Your chemotherapy will usually be infused using an IV pump. Your nurse will set the pump to give your medication over the period of time that is considered safest, according to chemotherapy guidelines. Your nurse will monitor you during your chemo treatment and will tell you what symptoms to watch for and report. For some chemo regimens, there are special requirements. For example, vital signs may have to be taken during treatment, or you may need to wait after the medication is given in case you have a reaction after the drug is given. Your nurse will explain these things to you. You may eat or drink during your treatment. You may also get up to go to the washroom. When your chemo treatment is finished, your nurse will measure your vital signs, review how to manage symptoms, and remove your IV or disconnect from your PICC or port. At your first chemotherapy treatment appointment, your nurse will give you a fever card, which shows the chemo drugs that you're receiving and reminds you of what you must do if you develop a fever. If you have a temperature of 38 degrees Celsius or higher following chemotherapy, then you must go to your nearest emergency department and show them your fever card on arrival. This will help the emergency staff to understand your condition and assess how quickly you need to be seen by a doctor. If you haven't been advised of your next treatment appointment by mail or by phone, you can check with the chemotherapy booking clerk on your way out. Your nurse will tell you where to go to see the booking clerk. The chemotherapy treatment unit team includes physicians, nurses, pharmacists, pharmacy technicians, clerical staff, transportation workers, housekeepers, and volunteers. Your CTU team works closely with the Community Care Access Center, which provides home care services. A CCAC case manager will visit you on your first treatment day. The CTU team is also able to consult the psychosocial oncology program, if needed, to assist in your care. This program is called PSOP, and it provides social work, dietitian, physiotherapy, psychology, and psychiatry services. You will find that the CTU team is relatively small, and the advantage of this is that you'll get to know the staff well, and they'll also get to know you well. We believe that our relationship with patients and families is as important as the technical and medical care that we provide. At all times, we strive to treat you as we would want our loved ones to be treated. We're your partners in care. Talk to us and help us to help you. As our take-home message, the CTU team members would like you to know that we're a highly specialized group who are passionate about the care of cancer patients. When you're in our care, your safety and dignity are our top priority. Welcome to CTU.